YouTube channel no ye Osofa Crazy TV. Sofu Crazy TV. But search engine no correct our channel no. That's why they amount. If you do need a 2 amount, say by also no how be ahwɛ no me ade nti bodua bi amane say Sofa Crazy TV no ho YouTube ko like and follow ye we dey be live e wo ho chat Sofa Crazy TV na so ye any penfo so share interviews how do no live story nti ho de any man go no e abrabo bu ne me beboa wo nti ko ne ko subscribe follow ye e wo YouTube ho after so Facebook bo Sofa Crazy ko ne ko follow your Facebook page no ho Facebook Twitter as the same Sofa Crazy or Twitter or do ho Instagram so no your ho and so edit more to all the social media handles in about Sofa Crazy obenya your ho technicians no more episode de yedwuma ho pa yin di kra so do you person be boy person be so ya sen ihia aboafo nkwe ihia pa se be boy na dwumadi no timi je ko akire number ni 0548 500 660 0548 500 first number now e pen phone bi din komo na fi de obi ano you know aka enko Bernard bibi e ko so ko de na me na ro bibi e bo and yes prostrate enlargement. It's a prostrate. Over to you.
And that's it. Your family injective. Say, mocha prostate enlargement, and I say benign prostatic hypertrophy and hyperplasia. The more patch when they say an air ruffle.
Okay.
Let me say, baby, you're doing so a family, your friend urethers.
Okay.
As beside the urethers, no, a honor prostate glands, no,
okay.
I say enlarge and I say a ekesia, not a mere urethers, urethra. Okay, yeah, just on a faban, not a miano. This is miana, a bond to connect that urethranimono, a kitty.
Okay.
This ano a bass and a wounds in sounds so pee if a pianiso.
Let's say, baby, a Joseph is a man, maybe now, but the Joseph and between us our problem, no,
but prostate, memma in your prostate. When you talk about benign prostate, hyperplasia and hypertrophy, a memma.
This is mad, the only prostate in the bee. Memma, hey, I just boogie that here. I didn't know what time I remember. My dear, and now because of you said, remember, it's a boy, no Fantiana.
Actually, it deals with age.
It is with age, okay.
Yes, okay. Mostly when men are growing older, and their prostrate glands becomes weaker. The more you grow, it becomes weaker. Unless otherwise, maybe you have a family history whereby probably you are someone who is prone of getting it too.
Okay.
But mostly it comes with age. So it's only for men. Women are not part.
Okay. Okay. And let's dive into the discussion now.
And when we talk about prostatic, benign prostatic hyperplasia and hypertrophy, we have some risk factors that will something we call predisposing factors. These predisposing factors will lead to you, the man, getting the enlarged prostate. As my brother just said, aging or increasing age. Basically, from 40 years going, that is when there is an increase in the prostate gland.
Okay.
So ideally, from 40 years going, every 1 year PR, you have to do a test. The test, we call it prostatic PSI, a PSA, prostatic specific antigens. And we are the mojani, the chumojano. And nobody determine the level of antigens. a range. It's a cost room that would detect say prostate large. None it also be so. We have a family history. To say me, I say, say me papa war me, and I'm a museum. Ubia enya prostate nibia. I'm prone to it. Likely say, I'm I'm prone to it. I've been predisposed to it. Okay, genetically because I have it's a familiar history. And another one we have obesity.
Okay.
Obesity also predispose us to prostate enlargement.
Obesity will be a why
Obesity comes with a lot of issues.
Yeah. But I won't say in our culture they say who will be a or body so this one is obese. And that's not
okay, obesity
medically no.
Obesity stages.
Okay.
It will morbidly obese, and not from your kg. Like if you talk about obesity before we can be obese, I also calculate the weight over height, that is height meter squared.
Okay.
The height number times in by 2. Now the weight or divide into the obenya now be to me determine say we obese and I say we obese. But obesity in a general term, the more almost like be and mood they are also predisposed to prostate enlargement.
Okay.
And when it happens, there was some signs and symptoms. We never kind of signs and symptoms. I be me who say assume benign prostatic hyperplasia and acid hypertrophy.
But before I say you better dive into let me answer. I can say we have family history. I really like to say, my father know on your prostrate enlargement by who go maybe and answer there are some things lifestyle that I will leave a bit me out. Prostrate.
I have to say diabetes, for example.
Okay.
You have family history of diabetes, of which you are predisposed to it. There are certain things that we are a bit exposed. You have already been exposed to it. So there are certain things we do the possibility of getting it is very high.
Okay.
So it's same as the prostate.
Okay.
And the family history is also about a gene. So if your father give birth to you, it's your father who give birth to you, and your father is having something, there's that possibility that you will also get it because of the gene factor. Because your father gene in one way or another has been transferred to you.
Okay.
And so because of that one, you are also prone of getting, so far as your father suffered it,
Okay.
you're also prone of getting it. It doesn't necessarily mean that you definitely get it. But you have to check on your lifestyle so that it will help you probably. If you even get it, it wouldn't be all that much.
Okay. You say, also be fair. But I say, bro, for those there, what you say and say, okay, near my year. Simple papa, they will cry now, and I enter a hand to be a D. So I'm lifestyle, the day can eat what you eat. I can go live, you did any amount, 2 hours in hand to nip a piano. But mamma, stop prostrating, papa will be. Because where ye be. But one when ye dear, which may ye be. I did not friend. I was see a country. You better try to say, blending and more I come up.
Okay, time I said, my initial stage maker, I said from age 40 years going, can you advise I will say every year I will be check PSN. Now you level say a cost before say be issue amount. When it is benign, it can be treated.
Okay.
When it is benign, we have ways and a lot of means of treating it when it is benign.
Okay.
But if it benign stage or but metastasis invading other places, you cannot treat it. You only manage it. So when we go forward, you get to know.
Okay.
Your number one radio station.
100.3 at this year FM.
Okay. At this year FM now, so the prostate enlargement, once and prostate cancer, no one can we can say the Boba Kuku Mami, and they can want some tip and inform him who say, say can say prostrate baby a be man no do so fan ye was I didn't know one chen wo sa de no say was it 40 years air corner was so call hospital ne check ni say hono ananya sa hono ananse hono but say omunye hu so afi ade na ya hono de a o say in a benign stage you know there's something with my ear but don't now was na say hono do bi da o say it is manageable they say was say ya isusu kakanka say enko ipo na say em fa problem memory I say more okay
And he said benign prostate hyperplasia in American cells tissues around the urethra and American
okay
and then enlarge and I say it increase in size.
Okay.
So when it increase in size now, a bema urethra and narrow space na them the ben narrow be kiti.
Okay.
And you know no be who you some signs and symptoms a bar a better say BC but signs and symptoms we interest when you have benign prostate hyperplasia and as hypertrophy.
Okay.
It can be from a lot of urinary tract infections.
Okay.
A bit more to me when you have signs and symptoms. And before it is confirmed, you have to go through some diagnosis. You have to be diagnosed.
Okay.
And this diagnosis, we have a lot of diagnostic measures that we put in place before it can be confirmed that it is benign prostate hyperplasia.
Okay. And this is I say do fa a home kakra na so you will be able to so me who say a home kakra but I know no and so say when ya come say what I call hospital be a hammer. Okay. And I know cause there are some doing some moves say there why anyway no your back can say
Okay.
Tell me first.
Any kind of signs and symptoms, and friend insurance. So every man, who say, it will be confirmed after thorough diagnostic measures has taken place.
Okay.
And you may are confirming. But signs and symptoms will suggest. Every I can be say, BBC, every to me about 10 years, young quiet, we near shake. Near confirm me say sure it is the prostate has enlarged or not.
Okay.
Indeed, the signs and symptoms in this one. The here part don't need here, but Bema, you have something called it frequent urination and I say menstruation. Johnson, ten. The reason the margin son 10 they say always because you try a prostate glands no pass around the urethra into a larger a baby
Okay.
on the miana to clone them I see kakra and I said it has enclosed small so the rate now says speed now I was unconscious on the banner so better. Okay, to kakre beba. We are not a crisis or okay, and a friendly frequency. And there is another one you call it agency. Okay, agency urination. There is also sign of it. And you have difficulty starting to maturate and as it to urinate. Or bedroom so for frat. Aging say about brain.
So yeah.
Sometimes a difference between you so yeah no way no but one way I be say and we start say so difficult but we call difficulty in starting urination or starting to maturate. And now we have another one we call dribbling. Dribbling in say why do you so we no as a bema do you so we in from any man can protect the animal
and what's be bad
crana nature but we know we and still don't say it's song a crack the show boxes now we say so go crack and a friend it's also a suggestive sign of prostate enlargement. And there is another one we call incomplete emptying of the bladder.
Incomplete empty of the bladder. Okay.
Over Jones every,
Mhm.
but baby, I just on the boa no.
Mhm.
Bladder and hona, I say a crahana, Johnson Kugu.
Mhm.
It's a can fa urethra muna and Kaba mountain.
Mhm.
Then you know to member, it become. But I know J. Some text and son of him say, it be a come.
Okay.
Because I need to me for your name.
Okay. 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 Okay.
And now, all Jones also are. Ochim. Strain ochim because back into force say a beba. A quantity. I was all for so ochim said the a bema de woman in beban.
Okay.
So these are some of the signs and symptoms that will suggest that you are getting it or you have already had it.
Yes, Nema will come over to me now, Nema. So, Beman be from no who say, or ye, your prostate enlargement. Let's say, we know ye. I won't a crack. In your home, can say, I won't a crack. It is also or money any bad wants to say, Bibi, yes. Of your son 10 nothing, or your so cry, of whom cries a plume, of whom cry, as a beef so good, and any can. Say, oh, yeah, totally ordinary done also. Nothing Jones, yeah, yes,
And difficulties are all started so
old ones are not say, oh, yeah, okay, do,
They are actually cardinal signs. But there are other urinary tract infections. A bit near Mawanya. Like a bit near Mawafilisa.
okay.
And the reality is that all these things that there are things when and my own who say problem be to say prostrate.
Okay.
But the only thing that can be confirmed through the test now
Okay.
But other urinary tract infections, a bit near Mawanya. So kind of but it is not always easy that almost all these things are all common when you have urinary tract infections.
Okay.
But prostrate enlargement will let you get almost all these kind of signs and symptoms that you're talking about.
Yeah, what you're talking, you mentioned those at the age of 40. Why is it that there's a specific age attached to this 40 years?
That's why we were saying that prostrate has to do with age. The more you are aging, the more your prostrate becomes. Because so after 40 years, you realize that they said the local dialect really said that the beginning of
life begins at 40.
Life begins at 40.
Yeah.
So at 40, it is believed that your system is not more. You are no more an adult.
Okay.
You are growing old like that. And so as you are growing older, your body system too is becoming down. The tissues and other stuff are becoming down because it wouldn't be like it used to be. Yourself and let me say a young boy cannot compete for something because at that age, your blood is in one way or the other getting older. You cannot be like a young person. The way you used to run, the way you used to do things wouldn't be the same because you are good. That is the reason behind.
Okay. I
100.3 at this year. Your number one radio station.
Okay, your number one radio station also goes out with you. I'm the process enlargement now. I come out some teacher. Or what how many also process in I come out some enlargement. You will more do me or the no as a my also. I won't crazy and I'll be whom you who say, whom Sanya Mana is a bema. Oh, yeah, prostrate, I was enlargement in your moon to rock and your the eye cassette crack, and your the eye cassette pan, what the a same court is a manichi. All right, although the best you may know, so good, 8,
100.3 at this year. Your number one radio station.
Episode fully social media handles in ready, YouTube, or so far TV, or videos ni nyinaa ɛwɔ hɔ wobɛnya no hɔ dwumadi wopɛ sɛ wobɛso yɛ ase na woboa yɛ no ntimi kɔ animu a ɛno so number no 0548 500660 wofrɛ yɛ a yɛbɛtumi no adi nkitaho ma biribiaa ayɛ kama big dreams multi-satellite and resolution center bɛtumi nso anam asɔre ɛfiri sɛ big dreams deɛ sɛ satellite decoder na wopɛ sɛ tv ati kɔpɔ mene brand a wonya bi wɔ hɔ tv stands woofer ɛnɛ yi a ɛnɛ deɛ yɛsɛ ɛyi na abɔ wo hd plus wobɛnya bi ama wo stabilizer wobɛnya bi led bulb remote biribiaa ɛyɛ ɛdɛm appliances biaa deɛ ɛmpa big dreams ho nkɔtɔ no baabi fi sɛ wokɔtɔ a na yɛwara ɔsan kɔ no akɔsɛe na sɛ de problem ambrɛ wo big dreams ɛwɔ safari bɛt aboro analysis ɛwɔ a ɔne fire service lady nhwɛne mu ɛwɔ kɔ hɔ na wobɛnya bi jokolen opposite misɛnua kodoa store na big dreams ɛsan so hɔ kɔ a wɔboa wo ama de wohia biara no wo nsa ka kɔ hɔ big dreams deɛ yɛbɔ ndia no agye so long lasting for your digital ɔnneɛma no kama ne kyɛ paa alright yɛnkɔ ɔpani bernard hɔ na ɔmfa yɛntoa so ne yɛhwɛ adesua yɛsua no ɛne ntoa so
it means that yeah, can say the menu kai. We have say some investigations to rule out other urinary tract infections. That signs and symptoms may make these signs and symptoms na you can and see the decline about preferring digital rectal examination. So digital rectal examination, what's happening is doctor over hospital and I say more when you can't wait when na you show won't feel no maybe I won't feel no do not say doctor I suspect it maybe sir digital rectal examination then insert here and they show it so they show her opishiko etra obi feel the prostate glands no be feel the size of it no either say I enlarge and I say enlarge. Okay. That is one first thing that they normally do, or that's not normal. That is what we usually do. Okay. A first thing, digital rectal examination. Okay. But then inside here, be sure also. Na or feel glance na way. I can see obi feel when say glance no I can see. Okay. It's I know you did it. You told me, you know, as I can say, and may make it other signs of urinary tract infection. It's a bit more urine test. So when you do the urine test now, the purpose of the urine test is to rule out other urinary tract infections. It's weird, you know, say results never. Now it is not any of the urinary tract infections that you're suspecting that. Then definitely you are heading towards what you are discussing.
Prostate enlargement.
Yeah, exactly.
Okay.
Then we have another one. That is what we call the PSA. It's prostate specific antigens. So the mekai and Zanka Benyanka free 40 years ago. You have to every year you do it. To know whether the level is increasing or not. I say a increase and I say a increase. But there is another one thing about the prostatic specific antigen. Okay, not say a increase here. There are other things that may make or that will lead to increase in the prostatic specific antigen level. Example is say recently surgery and some infection can increase it. Until before it can be diagnosed when you have benign prostate hypertrophy or and I say hyperplasia it has to go through some vigorous diagnosis.
There's also call if the doctor no free who's when you benign prostate
okay, it is a doctor near way now we say and yet Jinsumuya there BBI maybe to say we are now we'll be concluding or no.
Okay.
And there is another one, so a friend I want to run a blood test. This blood test no indicates that if there is some problems with the kidneys,
Okay.
they referring their kidney function test.
Okay.
You can't do it. Also, because you want to rule out any possible issues. Until you rule that one also out. Until if it is normal, then our concentration should be on the prostate enlargement,
Okay.
And when it gets to some advanced stage, there are some another investigations also where once the maker said when it is benign, you can easily treated. But when metastasis takes place, that is, it affects or it invades other parts of the body apart from the glands itself. That one, when they become cancerous, it's very difficult to treat. So that one you can't treat it, you only manage it.
Listen, me tell you, say, very benign, just say, I hono by a home pa, but what's a man home pa, the answer, and then cancer neighbor, no, won't me your way, this so soon, sir.
One say, you can't just add a benign.
Okay.
It's a type of cancer, but benign, just as in the afina, chassis.
Okay.
But the cancer metastasis are taking place, and I say I invade other parts of the body, and I say other organs.
Okay, and you're so
until when it happens that way, it's spread very fast.
Okay.
And it affects almost
other parts.
So when metastasis takes place, that's why I say we don't treat it, we only manage it.
Okay.
These are some of the laboratory investigations and physical assessments to confirm that this person indeed have or has had benign prostate hyperplasia.
Okay.
And I say prostatic cancer.
Okay. So all my science, what about the courses? Apart from so Bobo courses, does it run through the types of benign only?
Predisposing factors and I say causes just there can but when initially now that is what you call it benign.
Okay.
And baby is just around the prostate glands now increasing in size or the tissues there has multiplied. That is what you call the benign. But then when it gets to other organs, and I say, and normally it can even invade the bones within the pelvis. And so one is a metastasis has taken place. And when there is a metastasis or malignancy, it's not easy to be treated. You can't treat it, you only manage it. Because you might think, say, I can't bone wake again. Then let's go do something about it. Before you realize it has gotten to other parts. And our cancer cells will be able to be not spread. But say benign no more in 10 times and we have ways and means of treating it. So when you go to the management, you also talk about that one.
Radio station.
Okay.
Actually, the main cause is unknown.
The main cause of prostate enlargement is unknown.
Yeah.
Wow.
The main cause is unknown, but it is believed to be common with aging, just like
you explain.
The main cause is unknown. You cannot say this is the main cause of prostate cancer.
Okay, can maybe per your research, can lifestyle also affect? I mean, the prostate enlargement lifestyle, like what you eat.
Yeah, that was why Senior Man explained earlier about obesity and other stuff. Obesity has to do with your sedentary lifestyle.
But there are some people looking at their family. You can see that so for that. And on the crana, so no, I don't know.
What's that?
No, be how no. When I'm here, no, so when the band, the band, I'm from easy.
That is the hereditary aspect that we're talking of. If you inherited it from the family, and that's why we're also saying that prostrate enlargement, you can inherit it from your father. If your father was having some, or if someone in the family is having it, it runs through a gene.
Okay.
So they can transfer that gene to you, and you also get it.
100.3 your number one radio station.
Okay, me be say eti asene bantina sade ekọ echi no because you ha no tios na de ba ntino na yesa so amo hunu de prostrate enlargement and cancer no e de eba nti o me say hu science ni me be de minim si ebe to aso
100.3 your number one radio station.
Okay, the intro aso
it was no. Still, we are on the diagnostic measures.
Okay.
And for the more complex cases, more advanced cases or complex cases, you have something called transurethral ultrasound.
Okay.
Transurethral ultrasound. And the pattern is a FED, a probe being insected into your rectum. Now, more evaluate the size or more measure. Prostate gland. You have feeding the division also. As I make a beginning, make I say, first one a doctor, then say doctor, then say, every route. For you to know it that way, no, that obey it a transrectal ultrasound, no, the other machine, no, a feeding no the patient too, so that they will be able to visualize and see the size of it. And that is when all the fakes for diagnostic measures, no, among then they go to this transurethral ultrasound. Now there is another one, a friend, prostate biopsy.
Okay.
Prostate biopsy. So when you talk about prostate biopsy, is this taking of tissues sample from the prostate gland?
Okay.
Normally they are called for analysis to so confirm it if it is cancerous or something of that sort. Then you have another one, a friend on cystoscopy. Cystoscopy is a lighting flexible instrument to be, and then also being insected. This one rather is into the urethra, so that it will allow the doctor to see inside the urethra and the bladder.
Okay. 100.3 at
That
this
is
FM.
Cystoscopy. It's a visualization of something. In medical term, can say scopy, you do a new through machine or the share. Okay, need to help you to help the doctor. To these things are done by the doctors. Okay, to help the doctor to visualize through the scope to see the size of the urethra and that of the bladder.
Okay.
So these are some of the ones we do for complex cases, the advanced ones. And yet it's not limited to this alone. IOP, but these are the ones that you can say it helps in our system or to help for the doctors to diagnose it when you're weak. And at the educator can in bent nephew and can say Major so intent Major so I just only me bema mushishime use only mo to say Major so we are as a so me dana drum Major so just it's not what conclude with you say prostate enlargement and I say prostate cancer. No.
Okay. So say what test ya would you
vigorous test
doctor do video for moon and son ultima can say many prostate enlargement.
And no doctor and the catcher will say when you prostate enlargement and I say prostate cancer. Okay. One is a me to diagnosis or maybe do my DNA.
Mati almost once quite but this is so because I prostate enlargement no we a bear man out to me fire 3 times a week. Almost me fire sa when you prostate enlargement no. Oh Mati will be tin radio station be na we be any abra work say me fire we a bear man we 3 times a week. Be out me came on with fire make fire is a prostate enlargement would never be at this time. I'll be someone sana I prefer
okay. there are lots of still research keeps on going on, and in medicine or in medical field, every day there is research.
Okay.
But so far research about out, it hasn't proved it or hasn't shown say frequent sex will reduce your the
Chances.
possibility of getting prostate. That is some school of thought.
Okay.
And another school of thought also says a very slightly. To see be I ever say 1%. Like I say, idea ohana chichimba compare and maybe they were just guessing. That researchers they couldn't conclude it until left to me alone or left to some of us.
Yeah.
Most of the researchers don't approve or hasn't gotten that confirmed vigorous sexual intercourse reduce the rate at which you get prostate cancer. No.
So you want to ask something?
Yeah, it's just like he's saying.
Yeah.
Actually, there's no firm research that
Okay.
was, but what our understanding tells us that enough exercise reduce the rate at which you get prostate cancer
Oh, okay.
or prostate enlargement.
And sex too is
And
an
sex
exercise.
is an exercise. And so because of the exercise aspect of it, that makes people, or some research tells us that maybe it reduces the rate at which you can get prostate enlargement. Yes.
Okay.
And so it's possible to,
Okay.
but it is not really confirmed, but it's possible.
Okay.
Because the research will tell you that exercise is part of the things that you can do that reduce the rate at which you can get prostate cancer or prostate enlargement. And sex is also one. Prostate, like doing sex is an exercise.
Okay.
And vigorous one, of course.
Okay. So the only idea no, say, was it a mountain idea we have a boama, unya be, no can say, nano, and I say, and so see a promoting tintin bia, and Tina, be more, the one you so, it is a minute da. Bibliani, means I say, I say, to me, your portrait in it. And also can be so a bit back as a oppressor, but they need to piano.
I was in medicine or medical field, we believe in research. Or research in a day, and whereby most of the researchers need concluding on that is where we go.
Okay,
but we are also ruling it out because of some say another research say let's say 1% of it there is possibility say be reducing a crown. You can't rule it out.
Okay,
but then we always go for the majority opinion. And as exercise now kind of was talking about, this exercise is talking about you are trying to exercise but that part can only be exercised through sexual intercourse.
Okay.
That prostate, the prostate is found within our penis. In South America, I say urethra are surrounding with that prostate glands, and you can only do that through sexual intercourse. That is the only place that part can be exercised. Because there was to two America, Oberman is in Canada. I say sorry. Vigorous, the blood flow is going up and down and those things. That is exercise for that part, and that is the only place that it can be exercised through sexual intercourse.
Okay.
But we are not ruling it out. But we are not also saying say prevent it. No.
Okay. And to me, some of my solution I say for now who courses no say how can it be handled? So being a very day and especially benign who benign say number doctor confirms me near Australian after the dinner may.
Okay. We have there were a kind I would be so far edit treaty.
Okay.
Yeah. One, a different medication drugs. It's made the drugs. A boy. And drugs now you can get a drug and a drone meet me, I will be bidding, but me kakra, but at least there will be something where we have a different alpha blockers. And no, say the mower, I relax it, blood down on the neck, muscles, and now muscle fibers of the prostate, it's a no, the mouse are not. Maybe I'm making kind of war, a juma, a year or a war.
And it's a window, hereby bien,
David.
because I'm a tinner, radio super house, and I'm Moon TV. Says a prostrate, enlargement to New Jubia. Remember, say about brand beard, more torn by you. And that's okay, as a both who know can have a catch you.
Then they make kind of able from room.
Let's say,
In Ghana, this is your traditional medicine for.
yeah, okay.
Yeah, your traditional medicine.
Okay.
Our more regulated. I sure more hospital schools and so.
Yeah.
Tech.
Yeah, but so more, a doctor,
you honor. It's also be our musician moody. A woman ways and Miss Omuni say through their research and through the use of their herbs, if they think or they have come to a conclusion, say it's me treated, that is them. But me, I'm of the other view. I'm of the other view. And see, the one that drug your friend of 5 alpha retardics inhibitors. And also, the man shrinking the prostate.
Okay.
A shrinking on to say, I can't say shrinking, a man, no more. Prostate enlargement. I said, I beg you,
yeah,
more picture. It is a wood is a drew way man now. A man, ne shrinking, and more.
Okay.
Hunting to me, and you can see you. And things are preventing some hormonal changes. Hormonal changes that causes the prostate to grow. So it will shrink that hormonal changes. So that is another drug that you normally use. And in some cases, they can combine these two drugs. So we have a medical, the drugs one, in your macam, and another one is a friend in radiation therapy. Radiation therapy. That is when it has got into stages now. Yeah, that's the radiation therapy. Radiation therapy, the top touch and the top cancer cells.
Okay.
It's a heat. Not a cool cells. And we are another way to make the managing and as they treating.
Okay.
And now we have immunotherapy. Immunotherapy when your immune system comes down. You see, so we have some things, drugs that
100.3 Addition FM.
Okay.
We have drugs we give to boost the immune system. Because the one is an immune system no form anything we are the obeying be a cover fast. We are in your coin a bay. Free radicals in your kind you don't obey. But if you see immune system now, it's me a boy.
Okay.
And now the last one or the last but not the least, the least but not the last, surgery. Surgery. It's me we have to do surgery for the person.
And this that surgery, prostrate now that's how is it?
Surgery, what it's normally done is a doctor I know a urologist for
Okay.
Share from Euro.
Okay.
I don't know how to bring it, but urologist for no
Okay.
A surgery will be they go into the prostate glands with instruments. Okay. And no more there then instruments no more and another is fluid I free upper a wash out. There were number of hours or some way. But say I could check bros so I know day and a dance so but I know the young cohort. It's a friend of your surgeon friend a friend tape. Transurethral resection of the prostate. CURP. Then we say radical type say radical one. Radical see G prostate glands in everyone.
Okay.
Radical prostatectomy. beginning in your free honor. So these are some of the things that when it happens on way, and these things it hasn't got into the metastatic place. Metastasis ain't the key place.
Okay. Okay, so you know, baby, I boom, I be cancer.
So could reach that stage and then we can't do anything about it. We can't prevent, we can't treat it, we only manage it.
Now, let me ask you, say, stage now, after the Ahuna Cassiano, what are the signs and even if I don't who also say, make sense now, Homer Jones, so yeah, Puma and a crack me, I'm boom and boots of me so never. After the what are the signs and who's after they do the
Metastasis.
Metastasis.
I say,
a do baby,
malignancy be.
Okay, signs.
You see, when it happens like that, there is one cardinal sign: back pain.
Yeah.
Back pain.
Yeah. Okay.
Back pain, and you have something called edema. Edema not happen due to venous obstruction. Venous obstruction now. In now say moja need to make one out a blockade. And the edema at that time.
Okay.
There is obstruction there.
Okay.
And now there were hematuria.
Okay.
Ojun so abon so ojun so no moja wo. Ojun so moja wo. And our ojun so na moja wo no na we lose moja. So there will be anemia. Okay. And that side on that time metastases are taking place, it has affected a lot. So the kidneys also will be affected. And kidney need produce a different erythropoietin.
Okay.
And this erythropoietin helps us as a blood warmer increase now. And so when the kidney is diseased or malfunction, the erythropoietin will not be there. So you will not get what the needed blood is extended. And meanwhile, you are losing the blood also through the urine. So you become anemic.
Okay.
And there is weight loss.
Okay.
Because
you are losing blood
and there is loss of appetite.
Okay,
Because they do sana. The edge money per day. They don't to me only or if lost appetite and it goes with weight loss.
I'm
just do salad on the anime. Because I know the ain't me here. Yes, so
100.3 at the shit FM.
Also,
okay. Although you may see now, Subusua, Utino, in your Benado Heniba, a Canadian far and Titia, me and any booking Swaha, a habu Swaha, on Susan Wichidom, and then topic, Rika will say prostrate enlargement and cancer. They say prostrate, or maybe it was a prostrate, Bearman will be all doing so fun and in chain when they walk. You say I say ball beside a crowd say benign. I feel the I can say malignant,
affected.
This is the how
malignancy, it's not about it being enlarged.
Okay.
There are others who their prostate is not all that enlarged.
Okay.
But when they talk of malignancy, there's proliferation. It eats into other tissues. So when it gets to malignancy stage, it means that the body as a whole, it is not properly functioning because the body is interconnected.
Okay.
It is interconnected, so it will affect other vital organs because the way they are supposed to work, their work will be reduced.
Okay.
And so will be affecting the system. Your body as a whole. Nipadua and cancer and the heart nipadua na. When say ohunam baby eye oya. Don't mean kapoti say okay because other things are say no intimi the body nipadua no betimi aye no other aspect na I say betting me, betting me, and to me, ye.
Okay.
So, no, affect other part of the body.
Okay, wait me follow in our YouTube or Super Crazy TV. Go on, subscribe on it. Ne follow you because in videos in and hanging on it Emma also soon be a share YouTube channel now, Super Crazy TV now. So there were nice interviews, educative, you over. No, so no bit me now or to my abo calling or rubber call. Neko follow in our YouTube or Super Crazy TV. Facebook will see your Super Crazy page in the like page in the follow or Twitter and Super Crazy Instagram Super Crazy now so I will come. Do you person also say now boy may call anymore 0548 500 660 0548 500 660 offer ya penfoni obedi ikitangona bibia aye come on and you may number me di edi dwuma no ye 05 0